All right, we are back and we are rolling. So today we are talking about exercise, and specifically, so here's the, I guess, spoiler, not a spoiler alert, but so if you had to pick one exercise to do and you have a limited amount of time, what type of exercise are you doing?
Weights.
Absolutely. So this is on the importance, particularly for women and weightlifting. If it comes down to cardio or sports or yoga or stretching or whatever versus weightlifting,
Yep.
you lift weights.
Yep.
Right? Obviously, all the other ones are good. Do them if you have time, but if you are limited on time, do your weights. So today we're talking about the benefits of weightlifting and women specifically. We're going to kind of do our normal format here. We're going to go just kind of point by point. We'll kind of go every other one and talk about the first one. So first one, I'll let you take it away, Nurse Jessica. So what is the first benefit?
All right. Well, I mean, there's so many, and we're definitely going to go over, I think there's like 8 benefits, but
There's more than that, but those are our main ones we have listed.
Okay. Yeah.
Yeah.
So, number 1, it improves metabolic health and glucose regulation, which tends to be a big problem with a lot of my patients. I don't know if you see this a lot too, Dr. Craig.
Huge.
Okay, yeah. So, number 1, I know women like to hear this fun fact, but muscle requires more energy to maintain than fat, which really just means that your muscle has a higher metabolic rate while resting. So this really sustains weight management without the extreme dieting that clearly does not work for people. Muscle also acts as a reservoir for glucose, so it really helps stabilize that blood sugar level. And it has receptors on the muscle cells, which enhance your glucose uptake without needing insulin, which really reduces the risk for insulin resistance, which then leads to type 2 diabetes, as we all know. So those are kind of the benefits in that category.
Yep. And then so kind of on this topic, A1C, if you're familiar with it, it's basically kind of like a 3-month average of what your glucose levels are doing. What level are we kind of typically looking at? Or what's our goal, I guess?
Well, we definitely want anything less than 5.3.
Yep. Ideal. So and kind of like the peak of the bell curve is like a 5.0. So that's generally pretty good. And then kind of some interesting stats here. Fat at rest, you can burn 2 to 3 calories per hour per day. Muscle, on the other hand, is anywhere from 7 to 10, significantly higher. And then a lot of people, when they start working out, particularly women, I think a little bit more kind of fall into like the weight, weight chasing, I guess.
Yeah.
But so something to think about is 1 pound of fat is about the size of a grapefruit. 1 pound of muscle is about the size of a tangerine. Right. So as you build muscle, you lose fat, your size will change, but your weight may not actually change. And actually, sometimes it actually goes up.
Yeah.
Which for a lot of, I get it, right? You want to see the number go down, but it's not always important.
Absolutely.
Next one is hormonal balance. So there's a few different ways of this work. Number 1 is stress reduction, right? By improving your adrenal glands and the HPA axis and all that stuff. It has a direct effect on your hormones. It's going to lead to, weight gain, hormonal imbalances, fatigue, sleep issues, which just makes everything worse. It does boost your growth hormone specifically. And let me kind of be clear here, and we'll probably go over this a little bit as well. When we're talking about lifting weights, we're not talking about doing 5 pounds.
Right.
Because you can do 5 pounds 50 times. That's not doing anything to build your muscle. You want to be typically somewhere around 12 to 15 tops, and the last couple reps should be heavy enough to where you can't do it. That's what we're looking at. It does help with estrogen metabolism. Building muscle promotes efficient metabolism or excretion and detoxification of estrogen, healthier hormone profile, helps with PMS, fertility, and it helps women with the menopause transition. Also, it decreases SHBG, so that's sex hormone binding globulin, which basically kind of decreases your estrogen. So, sorry, did I say that right? It increases HBG, which decreases estrogen. There we go. And then let's see. So it helps with fatigue, weight gain, mood fluctuations, and that's kind of through kind of the hormone shift imbalances. Number 3, back over to you.
Well, just what you talked about, number 2 is so incredibly important, especially for us women as we age too, getting into perimenopause and menopause. I tell my patients, in your 20s, let's gain it because we're going to lose those hormones down the road. And it really has a big impact on us. So this goes along with number 3, which is bone health. Again, as we age, our chances of, osteoporosis increase due to our loss of hormones, and really resistance training just creates these little stressors on our bones. So it does encourage the osteoblasts, which is just bone building cells, to increase our bone density. And it also helps improve our muscle strength, which is, the area around our bones. So it just provides that like structural support for us. So that if we, have some instability, it can reduce our risk of fractures if we fall, or reduce our injury rates, which again, as we know, tends to happen as we do get older.
Yeah. And it's basically, right. Your muscles are the support structure that keep your spine upright. So if you don't want to become a hunchback, then you need to lift weights. So there's an acronym. It's called SAID, SAID. And anytime we have patients come in and they're coming in for osteoporosis and osteopenia and any just bone density stuff, I always explain this to them, and basically what it stands for is specific adaptation to imposed demand. And it's basically use it or lose it. So after the age of 30, we can lose anywhere from 3 to 5% of your muscle mass every year. And the key is if physical activity decreases. If it doesn't, you can maintain it. So you can have all the calcium, magnesium, vitamin D, K2, right? You can have all the ingredients that you need for healthy bones. But if you don't have the stimulation to make the healthy bones, then it doesn't matter, right? So having like all the ingredients to build a house, but if you don't have a contractor there to put it all together, well, okay, you're not going to end up with a house. So next one, it does enhance longevity and also your quality of life. Yeah, prevents sarcopenia, better recovery post-surgery. It is also very important so kind of what we talked about earlier in glucose regulation. So fatty liver, this is very, very common. Fatty liver is the number one cause is alcohol. So for people that aren't alcoholics, which probably in most of the cases that we see that have fatty liver, they're not alcoholics, and they suffer what's called NAFLD. So it's non-alcoholic fatty liver disease. The primary cause of that is sugar. So by lifting weights, sugar goes down, right? Fatty liver goes away. Let's see. Yeah, that was kind of it on that one. And then number 5, mental health. So back to you.
This is another good one that I tell my patients, especially as we age, it can support mental health by really just releasing those endorphins, right? The boosties, the feel goods, which help a lot of my patients who do struggle with anxiety or depression or any really mental health conditions. It also, you had already touched base on it. Like us women really care about the way we look, most of us, right?
Mm-hmm.
And
I think everybody does. Right?
Body image has a lot to do with how we feel about ourselves, whether it's ourselves or we want to look good for somebody, right? And I think as women age, we do tend to kind of put on that weight for whatever circumstance in life. And that really decreases, I feel, a lot of my patients' quality of life because they do not like the way they look with the extra weight added on. So I really encourage them, again, just for all the benefits, but developing that muscle and getting toned really does, number one, boost your self-esteem, but it's a sense of accomplishment because it's something that you didn't have. Then you start to look good, and then your self-esteem, and then you want more, and then you feel good, right? So it's this like repetitive event that I tell them, like, you just get started and your body image will be, what you want it to be if you make it, right? So
yeah, you can have, so kind of I always like to use the visual comparison and this also kind of goes back to the types of exercises too. If you look at like a long distance, like runner, or, marathon runner, like what do you picture, right? You picture usually kind of like super skinny, like, type stuff. And then you look at a sprinter and they've got, big muscles, nice and, right,
thick
healthy
legs,
looking. Yeah, that's kind of what you want. So you kind of tied together like number 5 and number 6 on here. So it supports mental health, right? You do get endorphin release. Exercise has been shown to be neurotrophic. So basically kind of helps with, right, obviously brain circulation, can help generate new brain cells actually. So reading and puzzles and all that stuff helps as well. And then kind of back to the physical appearance. I mean, like your muscles, right? So you can have kind of like flabby muscles or if you have muscle there, it tones things up. Kind of as like a little aside on this is you're much better off with prevention. You're familiar with the Leaning Tower of Pisa, right?
Mm-hmm.
So I like to watch like engineering things and stuff like that. And so one I ran across on practical engineering was on the Leaning Tower of Pisa, and originally it was built up right, and then it started actually to lean over a little bit, and because they had to like pause the building because there was like wars and stuff going on that, and then they came back later and they wanted to build on it. And so what they did is, so initially it was straight, it tilted, then they continued building, and they didn't continue building it straight. They actually started to build it in a curve to straighten it back out. So you kind of have like this curving thing going on. Well, the leaning had already started, so the leaning kept going. Well, now to fix the leaning, it took a lot more work to fix it. They actually had to like kind of burrow out the ground underneath on one side of it and kind of slowly lean it up. They had a bunch of wires pulling it up and like all this stuff. So they were able to fix it, but it was a lot more work to fix it after the fact versus just building it right in the first place.
Yeah.
And this, right? So an ounce of prevention is worth a pound of cure.
And that's why I tell
goes back to that.
my younger patients, I'm like, trust me, you want to hear this now, because if you can gain and build and sustain now, it won't be a problem in our later years, which, I mean, everybody wishes that they knew what they knew now, right?
Yeah. Oh, yeah. Absolutely. So number 7 on here, and again, this kind of ties together a lot of these things. It prevents chronic disease. So it decreases inflammation, helps with arthritis, heart disease, improve cardiovascular health. So it reduces LDLs, increases HDLs, improves heart health, decreases blood pressure. It's great for your immune system. So by increasing circulation of your immune cells, such as neutrophils, lymphocytes, monocytes, helps with interleukin-6, BDNF, BAP, P3s. So basically all of those things lead to decreased susceptibility to all types of infections, whether it's viral, bacterial, parasitic, whatever. So lots of benefits. And then last but not least, number 8 is
mitochondrial efficiency. So mitochondria are basically like the powerhouse energy production cells, and we want these guys to function really well. Basically, muscle movement really promotes mitochondria, and it's overall good for your metabolism, metabolic health, cellular health, so pretty much all things. So we want these guys to be as efficient as possible, so building that muscle will help them. And like you had just said, it pretty much will help with everything. So chronic disease, inflammation, oxidative stress, all disease, really.
And how often do you exercise? Oh, okay, let me rephrase that. How often do you recommend we lift weights?
I personally recommend 3 to 5 times a week.
Yeah. What's the bare minimum? What's the bare minimum?
Bare minimum, I won't let my patients go anywhere less than 3 days.
Yeah.
Personally.
You can maintain it 2 to 3 days. You might be able to gain a little bit for sure. You'll definitely maintain, but if you want to gain, then it does have to be more often.
Yeah. And like you had touched on, I do tell my patients, like, I'm not trying to make you a bodybuilder. I mean, clearly that's not our goal, but we do encourage, which I just tell my patients, it's called progressive overload, which basically you are increasing that weight till you can't lift that weight, which I absolutely love. Whether that's, like you had said, not starting out with a 5, but maybe a 10 or 15. Or what I tell my patients is you start off higher and you drop the weight if needed, because you want to be able to continuously do the reps, but you want to make sure that you're able to do the form correctly, which is really big. And you want to make sure that you're building that muscle. So I do like to encourage that.
Yeah, and it doesn't, a lot of women, I haven't heard it as much now, but so a lot of times when I recommend weightlifting, particularly lifting, I'm going to put in air quotes, heavy lifting.
Yeah.
A lot of women are worried about like, oh, I don't want to be muscular. Women can't really be muscular. I mean, you can to a certain degree, but you're not going to get muscular like men, basically.
Yeah.
Right? Because you don't have the hormones for that.
Right.
Yeah. Go heavy lifting, and heavy is all relative. Again, 12 to 15 reps is generally what we recommend.
Mm-hmm.
And then if you can't go above that, or if you have an injury or whatever, right? So you have kind of some additional ways to actually make it harder without going to heavier weight. So number one is make sure you have proper form.
Mm-hmm.
Number two, make sure you're doing your full range of motion, or as big of range of motion as you can, given you don't have any injuries. And then number three, and this is kind of a big one a lot of people don't think about, is slow it down.
Yes.
Right, which is huge.
I tell patients that all the time. I can never say it, diastasis recti with my ab muscle separation because I have had 4 kids. I tell patients my personal story all the time. I healed myself because obviously cosmetic surgery. I didn't want to do that, but I healed it myself. But I've been an athlete my entire life and everything's been quick and fast. And obviously that's all I ever knew until I started following somebody, and she really focused on slowing down your movement and breath work while doing it. And that completely changed my life. And now that I am into weightlifting, even lifting my weights, you will never catch me going full speed. I am slow. I make sure my movement is correct to the T, and I make sure my breath work is going along with that exercise. So there's always an in through my nose and out through my mouth. And I make sure that my core is always engaged throughout the entirety of the exercise, because that obviously is your core and you won't hurt your back and things like that. So I tell all my patients, go slow, use your breath work, and engage your core.
Yeah. And kind of the extreme of this, there's like a whole different exercise philosophy, or I don't know what you want to call it, but it's called super slow. So you basically do like 1 rep, but you do it takes like a minute to do the 1 rep or something crazy like that. So you get like a crazy burn. And in reality, it's good to do like all these different things. So you don't want to do just one thing because your body will start to adapt after a while.
Yeah.
So kind of finishing up here. So a couple of things. It is a use it or lose it. We are what we eat, but also what we demand our bodies to do and become, right? Yep. It's the whole SAID acronym. If you stay active, you will stay healthy. And then what about cardio though? Do you have thoughts?
Yes, I do. And I try to have my girls stay away from it as much as possible, because we do get obsessed with that. And we think that we have to do that cardio in versus out, and I hate it. So I really try to have them stay away. But what I do tell them is walk. And I encourage between 7,000 to 10,000 steps a day at the bare minimum, and walking, especially after meals. That's a lot of what I encourage, because I don't want that obsession to become what it has been in the past.
Right. But still do it.
I do encourage cardio. Yes. And I don't completely take it off the table, but I don't encourage it to become something that they obsess over, because they will, because they want to lose their weight. They want, and it becomes this obsession. So I do throw it in there. I'm a huge fan of HIIT.
Yeah, me too.
Because that's super quick and fast. It gets your heart rate up for a short amount of time. And I'll have them throw that in there anywhere between 2 times a week if we're working out with weights around 3, something like that. 2 to 3, it really just depends upon what our plan is for that patient. But
yeah, and we'll kind of dive into this maybe on a different episode. And it's been a while since I've researched this, but there was some interesting studies that I read. It's been a few years now, but they basically said that doing about 10 to 12 minutes of cardio, HIIT, whatever, getting your heart rate up, because your heart is a muscle also, and you need to exercise it. But getting it up for about 10 to 12 minutes, you get 80% of your benefits of doing cardio. So if you're doing 30 minutes of cardio, heart-wise, you've got 20 minutes, so you're only getting an additional 20% benefits. So the effort amount to get to that extra 20%, that's not worth it.
Yeah.
Yeah.
Not for me.
Yeah. My typical recommendation for most patients is you go lift weights, do it for 30 minutes. It doesn't have to be crazy long, 30, 45 minutes, and then do 10 minutes of cardio afterwards, and you're done.
Yep.
Yeah. All right. This has been Nurse Jessica and Dr. Craig. That is it on women and weightlifting. Do it.
Lift them.
Pump some iron. We'll be back.
See ya. There's nothing there.
Yeah. Let me turn this on.